Welcome to Sterile Pro Learning, Chapter 6 Infection Prevention. Infection prevention is one of the most important responsibilities of the Central Sterile Service Department. Every instrument processed in CSSD may eventually come in contact with a patient. Therefore, any error in cleaning, disinfection, sterilization, storage, or transportation can result in healthcare associated infections, surgical site infections, serious complications, or even death. CSSD professionals are essential members of the infection prevention team and contribute directly to positive patient outcomes. Healthcare associated infections continue to be a major challenge worldwide. Surgical site infections occur when pathogens enter the surgical wound after a procedure. The emergence of antibiotic resistant microorganisms has made infection control even more critical. CSSD technicians play a major role in breaking the chain of infection and protecting patients from preventable infections. CSSD supports infection prevention through five essential functions. First, contaminated medical devices are cleaned to remove soil and microorganisms. Second, instruments are inspected for cleanliness and functionality. Third, items are assembled and packaged correctly. Fourth, the correct sterilization or high level disinfection method is selected. Finally, sterile items are stored and transported safely until use. Every reusable medical device comes with a manufacturer's instructions for use, commonly known as the IFU. These instructions specify cleaning methods, chemicals, sterilization parameters, and handling requirements. Failure to follow the IFU can result in ineffective sterilization, equipment damage, and increased infection risk. Several important terms are used throughout infection prevention. A biocidal process refers to a process that kills or controls microorganisms. Healthcare associated infections are infections occurred while receiving medical care. Surgical site infections occur specifically at the location where the surgery was performed. Standard precautions form the foundation of infection prevention practices. Healthcare workers must assume that all blood, body fluids, secretions, excretions, and potentially infectious materials are contaminated. This approach helps reduce occupational exposure and prevents disease transmission. Asepsis refers to the absence of disease causing microorganisms. Aseptic technique includes all procedures and practices designed to prevent contamination and interrupt the transmission of infectious organisms. There are two types of asepsis. Medical asepsis, also called clean technique, focuses on reducing the number of microorganisms and limiting their spread. Surgical asepsis, also known as sterile technique, aims to eliminate all microorganisms and maintain a sterile environment. The five principles of asepsis are the foundation of safe CSSD practice. Understanding contamination status, maintaining separation of work areas, and correcting contamination immediately are essential for preventing infection. Any item used in patient care must be considered contaminated. Even if visibly soil is absent, microorganisms may still be present. CSSD staff must always treat used patient care items as contaminated until properly processed. Cleaning is the foundation of infection prevention. Proper cleaning removes residual soil and significantly reduces microbial contaminations. Without effective cleaning, subsequent disinfections or sterilization may fail. Sterility means the complete absence of all microorganisms. Since sterility cannot be confirmed visually, validated sterilization processes and monitoring systems are required to ensure sterility has been achieved. Dirty, clean, and sterile items must always remain separated. Contact between these areas compromises the integrity of the process. Moisture is especially dangerous because it allows microorganisms to pass through packaging materials. When contamination occurs or is suspected, immediate corrective action is required. No item should be used if there is uncertainty regarding its cleanliness or sterility. Protecting the patient is always the highest priority. The ultimate goals of CSSD infection prevention are to eliminate infectious contaminants, safely process and distribute medical devices, enforce evidence based standards, and support excellent patient outcomes through safe instrument processing. Part 1 ends here. In part 2, we will cover key infection prevention, hand hygiene, personal hygiene, and PPE. Finally, we will see how CSSD breaks the chain and end with a quick summary. Thanks for watching. Don't forget to like, subscribe, and support the channel for more CSSD learning videos. See you in the next part.